me to go?
Go.
Okay. So I have the rabies pole here. I'm going to demonstrate on Pete, our docile pit bull, how to use the rabies pole. But hold it, prepare to pull the lasso, and then release it by this little pop right here. So the friend's going to get into position. My videographer, wait, Pete, you good boy. So, no, we'll leave it closed.
Leave it like that.
Because Pete in this video is aggressive. And we're going to lasso his head. Come on, Pete. Don't outsmart us. No. Oh, poor Pete. There we go. And there. So it's around. Oh. Have to be ready to pull it. Pete. And then pull it. And we've got it. I'm going to demonstrate the cat burrito, which is another form of restraining a cat. Just use a towel, and we're going to wrap him up real good. You don't want to choke him too much. You don't want to choke him at all, really. But wrap up his legs. Maybe if we were drawing blood, keep one leg out. And then his legs aren't going to cut us. I can hold his head and hold off for a blood draw here.
Amber, she wants to talk to me.
Yeah.
Oh, okay.
I have my sterile gloves. Ashley put some sterile lube on my sterile surface here, and now she's going to feed us. And I am going to put some lube on the end of my catheter. I'm going to be generous with the lube. midstream.
Starting.
Okay, so I am going to do a urine cysto on this DOS. Once I've located her bladder, we'll open my needle, bevel up, and going in at a slight angle so I can see my needle is in her bladder, which it is. Once I'm getting urine, I can release. And once I've gotten my urine release section, then pull out my needle. I'm going to demonstrate how to express my dog's anal glands today, which will be the same for most dogs. So you want to make sure that you have a pair of gloves, and you'll want some lubricant. And anal glands are going to be located at 4 and 8 o'clock around her anus. So we'll palpate there, make sure that you can feel them, and then we'll place some lubricant on one of our fingers, my finger. Insert your finger into her anus here and then palpate around. You'll feel something that's about the size of a chickpea or a grape, and that's what you're going to want to squeeze and milk out. You can cut from there. Okay, I'm going to demonstrate how to clip nails right now, a dog's nails. We have two different choices of nail trimmers here. One is a guillotine and one is just more of a scissor. I'm more comfortable with these. Wait, Layla, stay. And we'll also want a something to use in case we quick her, which we won't, but we may. If you're able to, I like to do them this way because I can visualize her quick better, and move all the hair around so you can isolate her toenail. And with clear nails, it's a lot easier than black nails, but you see the pink is a blood supply, and that's the quick. It'll hurt and it'll bleed a lot if we quick that, so we just want to clip this white part here. And just get close, but not too close, and clip. And then you can actually, when I'm doing it this way, I can actually see the quick a little bit better. So I can see that it's still dusty, and I can clip around a little bit more until I start to see some fresh right there. It starts to look a little more fresh, not so dusty. I'm getting really close to her quick, so I'm going to stop right there. That's it. All right, I'm going to demonstrate how to trim a cat's nails. They're a lot easier than a dog's because they're all pretty much clear. You hold the foot, make your restrainer that they have your cat in control, and then all you do is clip the clear part out. You can see they're quick, very clear. So I'm just going to get that end off. Nice and easy. Same as a dog, if I go too far and hit that quick, it's going to hurt really bad and bleed a lot, so I don't want to do that. And that's that. Well, she does have a dew claw back here, so I'm going to get that as well. And that's that. Okay, so we're going to pill Pearl here because she will not take her pill in her peanut butter. I'm going to open her mouth, make sure I have some gloves on, and stick it back there. That's it.
All right.
Okay, so Penelope's due for her meds. She's getting a Clavamox and a Xenoquin. I have a pillar. She's not very nice. Doesn't like to get her medicine. And I don't think I'm going to be able to get both of them in here at one time. It's in. Good. That's it. Alright, I'm going to demonstrate how to clean Bogey's ears now, or a dog's ear. There's a couple different ways that you can do it. You can just put the solution right down into their ear, or I like to actually just saturate a cotton ball. The most important thing that we do is to get the solution in his ear canal. Hey, big boy. So I'm going to stuff the saturated cotton ball in his ear canal, then gently pull his ear, because his ear canal is actually shaped like an L, so we want to straighten that up a little bit, and then massage. And we'll be wringing out that cotton ball. It's going to get down in his ear canal. And we will take that cotton ball out. You might want to lean back a little bit and he'll shake. And that's going to get the debris out of his ear. Hi, baby. And I'll take a dry one after that to put it in his ear. And I will do the same thing, this time actually trying to wick the moisture up into the cotton ball. And you're going to want to massage down his ear canal, which will break up the debris that's down in there. And we can take that cotton ball out and see it's wet and it's got more goop on it. And I'll just take dry ones from then on out and get any kind of debris or wax that I see around his ear. He's a very good boy. And I'll continue this until the ear canal comes out clean. When you're cleaning their ears, sometimes you have to continue, like, we could end up doing more damage if I kept at it all day long. So if with an ear infection, we'll clean as best we can with one, and then the next day do it again. And each day more and more debris comes out. And that's it. All right, Penelope here has an ear infection, so I'm gonna clean her ears. She's on a pill medication, Clavamox and prednisone, so I'll be pilling her later for the medication. But I have Q-tips, cotton balls, some gauze, and my ear cleaner here. I have everything ready. Zach is going to restrain Penelope because she's a little bit feisty. So the first thing I'm going to do is use my Q-tip to get the obvious debris that's right here at the top of her pinna. You don't want to put a Q-tip in their ear because you can damage their eardrum, and cats are actually pretty sensitive down in their ear canal. So all the obvious chunky debris is out of her ear canal. And now I'm going to tear a little cotton ball, get it a little bit wet, just a little bit. It's a little bit more than I'd like. I'm going to put this in her ear and just massage it. So we want the ear cleaner to get down into her canal. Oh, sorry, kitty cat. And then pull that out. That's it. See, that's got some more debris on there. I'll just do it one more time.
Okay, alright.
Oh, no, baby. And I got a little more there, and now I'm just going to dry it. That's a good kitty. If we were using a topical antibiotic treatment for her ear infection, then I would just squeeze that into her ear canal and pull up her pinna a little bit and massage that around. And her ear isn't very inflamed, but if it was, I would also spread that ear cream around her pinna as well. And so I'll continue that on her other ear now. You're recording?
Yep.
Okay, I'm going to demonstrate how to put on a topical medication. This is going to be a flea and tick management product. It's Certifect. Layla is on trifexis, but we need to do something for the ticks. Sit down. Make sure you come a little closer. The important thing to remember when you're applying this is that you get it on the skin and that you put it high enough in an area that they won't be able to lick it. So you part the hair, and this is pretty much the same process that you'll do for a cat as well. Like I said, put it up pretty high, and then put the applicator between the hair, and we're just going to run it back and forth with the applicator actually on her skin. And that's it. Stop.
Go.
I'm about to place this esophageal stethoscope. The way that we would place this is we measure to where his heart would be, which is roughly where his elbow meets his chest. And then I would measure with my hands, and I'm just going to feed this into his esophagus. Now, because he has a trach tube in, I just need to open his mouth up because the trach tube is filling the trachea, so this is just going to feed right into his esophagus. And this would be a similar procedure if I was placing a gastric tube. The only difference would be that I would measure all the way down between the 8th and the 10th rib. By that point, we're well into the stomach. And if he wouldn't have a trach tube at that time, most likely, so I would want to make sure that I was in the esophagus. And the way that I would know that is there would be fluid that would come out once I got into the stomach or some gastric juices.
Yes, please. Close the door.
I'm recording that. Yes, please close the door for it.
Okay. I'm going to do a workup on my eye workup, and the first thing that we do before we flush or add any kind of fluid to her eye is check for her tear production with a Schirmer tear test. So we'll stick this in her eyelid and then hold it for 15 seconds. And we want to see that it passes the blue line in 15 seconds, which is already well past that, so she's fine. And I'll do her other eye. And again, already well past. I'm going to flush her eyes out a little bit because she's got big bulby eyeballs. I'm going to get some hair out of her eyes. Now putting some topical numbing on her eyes. And we'll let that rest for a second. You can pause it. Okay, so now I'm going to add the fluorescein stain to her eye, and I'm just going to drop this a little on there, on the strip. So I can drop it onto her eye. And the same with that. There we go. And now the goal is for all of that flush, all of that stain to rinse away from her eye. Anything that remains is going to be a defect on her eye. Let's slide back. So I don't see anything obvious, but I'm going to turn out the lights and use a wood lamp to look for any uptake. Still some flush. Still some stain. I'm going to flush a little bit more.
Yes.
What?
You do know you're not going to get all of that stain on there, right?
Yeah.
Okay.
You want to make sure you look at her whole eye so if we can get her to look in other directions, that's good as well. There's a little bit of uptake on this eye, which doesn't surprise me because she runs into everything and she's old. But we'll let the doctor know. Okay, we can stop it.
Oh.
Good. Okay, so this is our time pen that tests for the ocular pressure, which is another test for glaucoma. And this one is pretty complicated, but you want to hold it at 90 degrees to her eye, and then we're going to push the button, and it will actually pop out and hit her eyeball. And you should do it 6 times, and then it'll give us a reading. Okay, there goes 19. Okay.
All right, we're about to do an enema on a patient, so I'm going to prepare, and I have my enema bag, a red rubber, and some. Hey. So we want warm water, not hot. This is a little bit. The doctor ordered a 500 ml enema, and these bags hold a full liter, so I'm going to fill it up halfway. Put some lubricant in there, so it just eases things along. Screw on the top. Make sure that this is clamped closed. Swish it around. Now I'm going to attach the red rubber to the end because this is the part that we're actually going to put in the patient. Alright, that's it. I'm going to take the lube and my enema bag and grab my patient. We're going to head outside. Okay, so I'm about to do the enema. We have the bag hanging up so that it will flow with gravity, and Cam is restraining the patient. We're going to lube the end, and we're going to advance. And we'll just advance it until we start to get something back, and you can turn it off. All right, this dog is getting some subcutaneous fluids. You can see that the needle, it's a large hub needle because this is a large dog. You can use an 18 gauge needle safely with him. And as the fluid fills up, it gets pretty tight. So you just want to massage the area and kind of loosen the skin up around it so it's less discomfort for the patient. And typically you want to have the bag held up high. Sometimes, to speed things along, you can have someone squeeze in the bag for you. That's it. Subscriber video. All right. I'm going to bandage my patient's back leg here, and I have all of my materials. The best thing that, if anything, I can say is to be prepared, have everything ready at your fingertips. So we have scissors, a tongue depressor for our stirrups, and the tape, which I'm going to just go ahead and get started. We'll tear off 2 pieces of tape. One's going to go cranial and one will go caudal on her foot. And we'll go pretty high up. And we're going to use our tongue depressor to keep that straight. And there we go. This is going to provide us traction, can hold her leg, and also use this to secure the bandage. Cast padding is our first step. Start low, but make sure that we have enough room that her toes are going to be exposed. And roll with the roll on the top. So we just travel around her leg and be consistent. Coming around. You can't go too tight with this material. It will tear if we go too tight, so it's forgiving. And we're just doing a Robert Jones this time, so 1 layer is going to be sufficient for a bandage. have our cling wrap. This is not as forgiving, so if there's going to be any constriction happening on her foot, it'll happen from this or from the top layer. So be tight, but don't go too tight. And again, be consistent with our overlapping. Keep our roll close to the body. We are up over the stifle here. The goal is to keep her legs straight, but natural. Now I can, this is where the stirrups, you're doing so well, good girl. Easy girl. Twist this back.
Is that straight in the back? Can you check on mommy?
Tasha is right there. So our stirrups have been folded back and are now taped to our bandage. Girl. Okay. And now our top layer is going to be Coflex or vet wrap. And you can
This is not gonna be a long
unwrap it and wrap it back up, roll it back up. Just for ease of use. Same thing. This again, we don't want to go too tight with. This will be constricting and cause pressure sores, swelling, discomfort. Good girl. And use just a little bit more to finish that up. It's helpful to have sharp scissors also. There we go. You can use a small amount of this to wrap around the bottom of her foot, give her a little bit of traction. Some doctors like to put a little up top. With so much hair, it's not really ideal. She'll rip out a lot of her hair. On the inside of her leg, it might cause her some discomfort also. Tear skin. Oh, goodness. So it's really important that we can see some of her toes under here, because signs of bandage failure or, hey, it's okay, good girl, or that it's too tight, and within the first day we'll notice some swelling, which means that these toes, these middle toes, will splay out like that. And you also want to be able to feel them if they're getting too cold. If their parents think they're too cold, the bandage might be too tight, and so it's cutting off circulation. So we'll just put a little bit of this right on the back here so that she can have some traction when she's running around, which hopefully she won't be, but she still has to get around. And you'll want to make sure that we cover it up in the rain also. Get in a little sack or Ziploc bag and arrange that around her foot so it doesn't waste. But they should come back every 3 days to have that checked by their veterinarian. And that's Robert Jones.
Shooting.
Okay, so we are removing this Robert Jones bandage from our patient. The first thing that we'll want to do is be aware of, if this is a surgery site, where we should want to not cut. So be aware of where the wound is or whatever the reason that she's bandaged for so that we can cut on the opposite side. And it's best just to go in layers because the thicker you try to cut through, sometimes it just gets dull. We want to be aware of any strike through, any odor, anything as we're taking this bandage off. Nice clean bandage underneath. Just going to keep going layer by layer. If she is going to have a bandage reapplied, then we're not going to take off the tape, her stirrups. We'll just leave those pieces of tape intact and we'll just cut it off at the tips here. That way, if she needs to be rebandaged, we can just put tape right over the top of this. Otherwise, we can take the tape off. And that's that. You can remove it. You can stop. You're going?
Yeah.
Okay, so right now I'm putting my stirrups on my patient who is about to get a splint. And the reason that we would be putting a splint on a dog might be to stabilize a fracture. She came in on emergency and, wasn't going to be getting surgery. But we put a splint on, we put stirrups on, a piece of tape with a tongue depressor in the middle. And then the first thing we're going to do is wrap some gauze around here. You need to maneuver.
Just give it more support. There you go.
Now this is very forgiving. It'll tear if we pull it too tight, so I can go pretty tightly with this because we don't want it to fall down, and we want to make sure that her arm is adequately padded between the splint and her skin, so there aren't any pressure sores. I want to be consistent with my layers. I want to do the same amount of overlap every time. She's got a wee little arm.
I'm going to move my hand down to below. Oh, that's sweet.
There we go. So she can use our stirrup, and I can measure about how much farther I need to go. You go a little bit longer. You're all right.
She looks like she has a broken arm.
She might.
She might have a broken arm.
Our patient's 19, so it's very, very reasonable. And I'm going to tear this, stick it. And I did a little extra padding right up here at the top. And this is a padded splint too right there, so I feel really comfortable that she's not going to get any kind of pressure sores here. Now I'm going to use my cling to go, keeping my roll on top and staying close to the body. I'm going to wrap the splint to my patient's leg. You're being a very good girl.
Mm-hmm.
All she sees is a treat at the end of this.
It's all right.
Alright. Now I'm going to cut this. Thank you. Fairly. There we go. And so now I'm going to use my super long body stirrups that I made here. twist this around, and this will hold that cling in place. I'm just trimming it because I made it too long and it's up in her hair.
It's okay. You're almost done. You're almost done. Yeah.
Turn it up and around. And I left some space down here so I can see her toes, which I want to watch for any kind of swelling when I send her home. Let mom and dad know to watch out for swelling. And they'll be able to check the temperature, see if her toes feel cold, which will mean that my bandage is too tight and they'll need to come back so that I can fix it. And then the last thing we'll do is put some Coflex or vet wrap. Not yet. Oh, thank you. That was perfect. There we go. So I want to make sure that I send mom and dad home with a bag to wrap her foot up with in case she goes out in case of the rain. And I can see her toes, and I can see a little bit of her paw pads there, and her splint's intact, and I'm happy. Thanks.
We're going.
Going? All right, so we're going to remove this splint from our bandage. When I take it off, I'm going to want to look for any kind of strike through, any smelling, anything that's stinky. But best way is to just be aware where the splint is and be delicate, because most likely she has a splint because of a broken bone, so we'll want to be real careful and try not to cause her any additional pain, and go in one layer at a time. These are great scissors. Much better. Thank you. There we go. I know. That's a good girl.
Good girl.
So I'll leave these stirrups intact just in case the doctor wants to put another splint on there. There you go. And that's a bandage removal. Okay, so Maya has presented. She was attacked by a dog and she has an oozing wound in her abdomen. So what we're going to do to place a pressure bandage on this, because we don't want it to continue bleeding until she can get treatment, is we're going to use a pee pad or a Tefla, but the Tefla is too small, so it's just a cut up pee pad works just as well. We're going to place that as the first layer against her wound, and then we're going to use some cast padding to secure that to her body. I'm going to go under your arm here and grab it. Now with this cast padding, I've said this before, that it's very forgiving. It's very, it will actually tear if it gets too tight, so it's safe to go, oh dear, go tight with this. Some wraps there. So we want that pee pad to stay in place right over abdomen. Leslie's helping holding it, and we're going to wrap this real tight. Even tighter than you would probably feel comfortable doing it on a bandage that was going to stay, like a Robert Jones, because we're not worried about cutting off circulation here. We're putting pressure on the wound. I'm going to go over this a few times. And we'll rip it, let it stay. Confirm that pee pad is in there, and I've actually contained her abdomen, So now I'm going to use a little cling wrap. Again, I'm going to go tighter on this than what I would typically feel comfortable doing because the purpose of this bandage is compression. It's not going to be staying on there very long. There we go. Girl, good job. Hey, girl. And I used the longer vet wrap just to minimize how many times I had to go around. It'll optimize coverage. And I'll go over her abdomen. I'm going to cut it. You can see that she now has a nice little tucked waist that's going to be compressing that wound and holding her, stopping any bleeding and holding everything in place.
Go.
This cat just presented as an emergency. Shadow was in a dog fight, in a fight with a dog. He was missing. He's obviously lateral. This is an emergency. So I'm going to get his vitals, listen to him. We did already set up a Doppler so that we could listen to his heartbeat, but if I hadn't done that already, then I would say that he's obviously painful and depressed. Capillary refill time's a little slow, less than 1, greater than 1. Does have an elevated heart rate. The immediate problems are obviously his wounds. He has a pretty serious wound around his anus here that has maggots, and then he also has this really bad wound here on his abdomen. Again, very painful. I'm going to get his temperature. Don't want to get this rectally since he has a wound there, so I'm going to get this in his axial. And when you're doing this, I want to add 1 degree to whatever it gets. While this is, his temperature is reading, I can check it. I can count his respirations as well. His respirations are about 48. Temperature's still reading. This is a slow thermometer, but we're at 100 right now. I'm definitely going to want to get the doctor involved with this immediately, which she already has been. But if I was just seeing him, then I would definitely want the doctor to be involved immediately. You can stop.
Okay, so this is Lucy. She's getting a dental today. We just finished up her dental radiograph, and she's now in lateral recumbency so that I can evaluate the level of disease in her teeth, on her teeth. And I'll do that by using the dental probe and explorer here, in which I'll measure the depth of her sulci, and I'll want to notate the deepest levels that I get on each tooth. Anything over than a 3 is problematic and should be brought to the doctor's attention. I'll also want to take note of how much bleeding this might cause on each one of the teeth. She has minimal bleeding. So I would continue that on through all of her teeth. We did ensure that her eyes are loose, but since we flipped her, I'll go ahead and move them again. And that's important to avoid getting any of the debris that we're aerosolizing on her eyes, and also her eyes remaining totally dry. Oftentimes along her caudal teeth back here on the premolars and the molars, usually this is an area that gets caught up with a lot of calculus, and you'll use your calculus removal forceps. You'll lay it flat against her tooth along the gum line, and I'll squeeze and pull away from the gum line, and it just chips right off like that. So I would continue doing that all along these back teeth, and also maybe a little bit on this canine right here. Sometimes it's tricky on that one there. I'll also want to use the Explorer to feel along the surface of the enamel for any kind of defect, and I would be looking for a glassy type smoothness or any kind of chipping or breaking. Her teeth look pretty healthy. She's young. We'll also want to examine the inside of her mouth for any kind of sores or masses, make sure that all of her teeth are present and accounted for, which they are. I've already done the other side, so she has that back tooth back there. A lot of times gets lost in older dogs, but she has all her teeth. All right, and so after I'm sufficiently happy, I will continue doing this after a minute. Then I'll use the ultrasonic scaler, being sure to keep this flat against her tooth. And I want to start at the gum line and move down, spending no more than 10 to 15 seconds on each tooth. Staying any longer on each piece of the tooth and can cause permanent damage. And I'll always want to make sure that I move down away from the gum line. Being careful not to use the tip of the probe, because that also will cause permanent damage on her tooth. This is a good time also not just paying attention to these teeth, but paying attention to the palatal surfaces of these teeth back here, and noting any kind of staining that might not come off, getting these big teeth back here. Okay, you can stop. Go. I have now finished scaling her teeth, and I am happy with the way that her teeth look. After I finished with the ultrasonic scale, I took a rinse with some water to get any remaining debris that might be in her mouth, or leftover calculus, or any kind of blood clots that were left hanging out. And you can do a little spray as well with the water. I'll then use a polishing. I'll polish her teeth, which will smooth away the surfaces of her teeth that I may have caused any micro defects from the scaling. And I want to make sure to make contact with each and every one of those teeth on all the sides. Okay, that's good. So, once the teeth are thoroughly dried, I'm going to apply a fluoride treatment, which is going to strengthen the enamel. A little bit goes a long way with this. We're just going to spray it in our hand. Smells delicious. And rub it along all the surfaces of her teeth. And we're just going to leave it there. And before I finish, I want to remove the gauze that I have packed back there. And we're all done. Now cleaning your teeth.
I'm going to talk to you about the importance of home dental care right now. Dogs have teeth the same as us, and they need to be cleaned just like ours. It's something that often gets missed at home, but we often complain about our dog's bad breath, yet we can really play a part in cleaning that up. And it's important as well because just like humans, dogs suffer from gingivitis and calculus, and if the infection gets bad enough, it'll actually affect their organs and can set up an infection, like I said, which can lead to kidney failure and other really serious problems. So veterinarians recommend that dogs get their teeth cleaned twice a year, just like humans. Sometimes you can stretch that out longer if you are practicing home dental care, and there's a lot of options that you can use. You can use a toothpaste, which you always want to make sure that you're using a dog-approved canine or feline. You can brush your cat's teeth as well, because dogs often have a sensitivity to ingredients that are in our toothpaste. So you want to make sure that you're using an animal toothpaste. And then there's toothbrushes that are similar to ours, smaller for smaller patients, and then a larger one for your big dogs. And there's also a finger brush that makes it a lot easier to manage your pet. There's water additives, which you can add to their water. Nothing beats brushing, but this may be, it's better than nothing. It's something that you can add and helps with their breath. And then everyone's really familiar with dental chews, raw hides, greenies. You just want to make sure that your pet is a responsible chewer, because if they aren't, if they're swallowing them whole, then of course that can lead to bigger problems like a foreign body.